The surgery I've recommended to correct your bunion is called a modified Lapidus procedure. There are three main parts to this procedure that will all focus on correcting the deformity of your big toe. Number one is fusing the joint that connects your first toe or big toe to your foot. This joint is called your tarsometatarsal joint. This joint does not have very much motion in a normal foot. Fusing the joint means knitting the two bones together on either side of the joint to eliminate motion and allows us to correct the deformity of the big toe. In order to fuse the joint, we need to use a plate and screws, and sometimes just screws alone, to hold the joint in position until the bones have a chance to heal. Typically, this plate and screws stay in forever unless there is a specific irritation that you develop from the plate and screws down the road. The second part of the procedure is removing the bump on the inside part of your big toe. This helps to reduce the rubbing of your big toe on your shoe and also allows us to tighten the capsule or the wrapping of the joint to help correct the deformity further. And number three is releasing the tendons and soft tissues on the inside of your big toe, allowing the toe to relax in a more straightened position. Together, these procedures allow for correction of your big toe to a straighter position. I'd like to go over what happens on the day of surgery to explain everything so that you know what to expect. The main thing on the day of surgery is that you will discuss the plan for anesthesia with one of our anesthesia team members. They will talk to you about whether you would like to have what is called a block. A block is a local anesthetic which freezes your leg or numbs your leg so that you're unable to feel it. This means you cannot move or feel your leg for the first 12 to 36 hours after surgery. It also means that you do not have any pain at the site of surgery for that period of time. You will also have a general anesthetic for the surgery. The main goal of this block is to control your pain for after the surgery. The anesthesia team on the day of surgery will discuss with you the risk and benefits of having a block procedure, and then you may decide whether this is something that interests you. After the surgery is completed, you will have a cast that is a partial cast, which we call a splint. This will stop you from moving your ankle and foot. You will also be provided with a special pillow called an elevation pillow to assist you with elevating your foot, especially important in the first 2 weeks after surgery. I ask for that the first 2 weeks after surgery you elevate your foot above the level of your heart as much as possible. I generally recommend 23 hours a day, only getting up to go to the bathroom or to eat your meals. This is very, very important to limit the swelling in the foot and to give your surgical incisions the best chance at healing successfully. There are no bandages or dressings for you to change after the surgery. The cast will protect your incisions until you come back and see me in clinic. You will have this splint on for approximately 2 weeks after surgery. You cannot get the splint wet, therefore you must protect the splint when you bathe or shower by putting a plastic bag or other protective material over the splint to avoid water getting on it. After surgery, for pain control, we use many different techniques to help make sure you're not in severe pain. The number one technique for limiting pain is actually elevation as well. You can also apply ice packs, and frozen vegetables also work as well, applied to the front of your cast for 30 to 45 minutes at a time, up to 3 times a day. This is most useful in the first 2 weeks after surgery. I will also give you prescriptions in your preoperative appointment for both pain control medications as well as other medications. The number one medication that I would like you to start taking after surgery is Tylenol. You should take 500 milligrams of Tylenol every 4 hours from the day of surgery until 5 days after surgery, regularly. After 5 days, you can take the Tylenol only if you need it for pain. If the Tylenol is not bringing your pain down to about a 4 out of 10 on a scale of 1 to 10, then you may take one of the stronger pain medications that we give you, which is called oxycodone. Oxycodone is to be used only as needed for a pain level of at least 4 out of 10. Always take Tylenol as the first choice and the oxycodone as the second choice. Most patients only need the oxycodone pain medications for 3 to 4 days after this surgery. If you do have a block for the surgery, it will take approximately 12 to 36 hours for the block to wear off. In order to avoid a severe spike in your pain at the time that your block wears off, I recommend that before bed on the day of surgery, you take 1 Tylenol and 1 oxycodone, and do the same when you wake up in the morning on the first morning after surgery. 1 Tylenol, 500 milligrams, and 1 oxycodone. This is to prevent you having a severe pain spike as your block wears off the next day. I will see you in my clinic at approximately 2 weeks after the surgery. At this clinic visit, we will remove the splint and check your surgical incisions. If everything looks good, we will remove all of your sutures at this time. We will then change your splint over to an air cast boot. This does not mean you can walk on your foot. In fact, you are not permitted to put weight through your foot for 6 weeks after surgery. The boot allows you to remove it to wash for showering, as well as allows you to remove it 3 times a day to move your ankle and toes to prevent stiffness. I would like you to spend 10 minutes every day, 3 times a day, moving your ankle up and down and your toes up and down after this 2-week visit. You may shower after this visit, but you may not soak the foot. Therefore, no bathtubs, no hot tubs, and no pools, at least until 6 weeks after surgery. Also, at your 2-week visit, I will give you a prescription for physical therapy. Physical therapy is meant to start approximately 5 weeks after surgery. This allows you to have time to find a physical therapist and arrange that appointment to start at the appropriate time. I will see you again at 6 weeks after surgery, at which point we will get an X-ray of the foot to ensure healing is progressing appropriately. If the X-ray looks good, I will then let you start to put weight through your whole foot in the air cast boot. Most people use the air cast boot until 8 weeks after surgery and then transition to a regular walking or gym shoe. The reason it takes 8 weeks to go into a regular shoe is that your foot tends to be still too swollen before then to fit into your own shoe. Please do not walk in your bare feet until 3 months minimum after the surgery. I will see you again at 3 months after your surgery when we will get another X-ray to confirm healing. At this point, you should have graduated from the boot over to your regular shoes, as well as be near or completed physical therapy. There are no restrictions to your activity as long as we have not encountered any complications at 3 months after surgery. There is still a limit to how much I am able to correct the position of your toe. For example, if you have a wide foot, I cannot give you a narrow foot. However, generally, the position of the toe is much improved. The screws and plate, as I said, stay in forever, but please let me know at your follow-up visits if you're finding them irritating, and we can talk about a plan to remove this hardware at approximately 1 year after your surgery.